Lesson 7. Common Injuries. Lee hurt a muscle in his thigh during a volleyball game. The injury was really painful, and he had trouble using his leg. He told his mom. She made him stop playing until the muscle healed. Lee suffered from an acute injury. An acute injury is an injury that happens suddenly. Strains, sprains, and fractures are 3 types of acute injuries. A strain happens when a muscle or tendon is overstretched or torn. A tendon is a tissue that attaches a muscle to a bone. Strains are painful. The injured area may feel weak. Sprains happen when a joint is twisted suddenly. The ligaments that connect the bones to the joint are stretched or torn. Sprains are painful and usually cause swelling. A fracture is a cracked or broken bone. A fracture is painful. The injured area can feel weak, can swell, and can bruise. You should report an acute injury to your parents or teacher right away. You may need to see a doctor. First aid includes rest, ice, compression, and elevation. These steps reduce swelling and pain. You rest the injured limb, then you put ice on it. You compress the injury by wrapping it in a bandage. Finally, you elevate the injury on a chair or stool. Remember, rest, ice, compression, and elevation. Remember that the first letter of the word spells rice. Not all injuries happen suddenly. A chronic injury is an injury that develops over a long period of time. 2 examples of chronic injuries are stress fractures and tendinitis. A stress fracture is a tiny fracture. Tendinitis is an irritation of a tendon. Increasing physical activity too quickly or exercising too much can cause chronic injuries. They can also happen when you use the wrong equipment or exercise on uneven surfaces. Your doctor should treat chronic injuries. He or she may ask you to do special exercises. Otherwise, the best treatment for chronic injuries is usually rest. Some chronic injuries can take a few months to heal fully.